Hello, I am urologist Omer Erdamakaya. You failed during intercourse with a condom. In other words, you tried to use a condom during intercourse and failed. Does this mean that you have erectile dysfunction? When it happens once, the person has experienced erectile dysfunction. What does this mean? The person experiences erectile dysfunction once. He has experienced that feeling of inadequacy once. After experiencing it, he starts to wonder if it will happen to him again in his next intercourse. So the person starts to invoke that prophecy. In other words, performance anxiety, that is, the anxiety of erectile dysfunction, is now occurring. In studies conducted in the 20 to 25 age group, it was found that about 25% of them had erectile dysfunction when they tried to have intercourse with a condom. And for this reason, they completely moved away from condoms. There can be many reasons for this erectile dysfunction. Those who had erectile dysfunction with condoms were more likely to have attention deficit syndrome. In other words, the person suddenly concentrates on the condom and suddenly distracts from sexuality and experiences erection loss. Of course, there are many reasons. For example, not having condom training, preferring larger condoms, having too much difficulty in putting on a condom, or trying to put on a condom before reaching a sufficient erection, or having an argument with his partner at that moment. Or the low level of pleasure after wearing a condom during intercourse, that is, the loss of erection because he cannot get pleasure, maybe because he uses a thick condom, he does not prefer a thin condom. Therefore, failures may occur when using condoms during intercourse. This is something that has been experienced by about 25% of the population. Let me tell you what a very close friend of mine told me, which many people have experienced. In the youth period, there is guidance to use condoms so that there are no sexually transmitted diseases, to protect you from unwanted pregnancies. There is still this kind of guidance. After you use condoms once and the intercourse you would have very beautifully ends in frustration, you don't use it again. Or you rip off the condom during intercourse. You continue the intercourse without a condom. Or according to the survey studies, after removing the condom, the woman tries to stimulate again by hand or oral sex. So the situation is tried to be saved. Even if the situation is saved and the intercourse continues, this remains in the back of the mind. Not 1 year, not 2 years, but 30 years later, they still continue without a condom. After 30 years of condomless intercourse, my friend's new partner tells him that she will not have condomless intercourse. And my friend wants to have intercourse with her. He also takes a small blue pill during intercourse to increase his sexual power. Because he is afraid of what will happen to him. He invokes the prophecy. And even though he takes a little blue pill, he loses his erection while putting on a condom. And after removing the condom, he cannot get an erection. Even though the female partner performs oral sex. And of course the sexual intercourse ends in frustration, he gets depressed. And he relives what he experienced 30 years ago. Some people can really have arousal problems with condoms. In other words, when he cannot get that feeling of pleasure, he can really experience loss of erection. So, what should be done in this case? If it is a really suspicious intercourse for you, that is, if you do not know the past 3 months of the partner, you should not have an intercourse. But if it is already your own partner, then what needs to be done is male vasectomy. But of course, it is not even possible to say that for young men. So it is impossible. Then it is necessary to have intercourse with a routine partner if you are not going to use a condom. Or if you think in terms of pregnancy protection, then the female partner must be protected. But in the end, let's return to our main topic, erectile dysfunction with condoms. Does erectile dysfunction with condoms really mean erectile dysfunction? No. But studies also show this. About 25% of those who have erectile dysfunction with condoms have a really mild erectile dysfunction. In other words, their erection quality is not as good as those who can have intercourse with condoms. But 75% of those who have intercourse with condoms and fail do not have erectile dysfunction. Because these people can have sexual intercourse comfortably in their normal lives. So this does not mean that every person who has problems with condoms has erectile dysfunction. So what should be done? First, it is necessary to increase the general knowledge about condoms. First of all, you need to use a condom that fits your penis. When you have a full erection, you need to put on a condom. You need to know how to put on a condom. To know this, it is enough to put a few condoms on your penis beforehand. The brand of condom you use may be different. And the elasticity of the latex used may be different. So it is definitely useful to try beforehand. You need to know the inside and the outside of the condom so that you don't linger on which side you need to put it on during intercourse. You need to put on a condom quickly. And then you need to continue the intercourse. Condom thickness is important for the amount of pleasure you get when using condoms. That's why you need to choose the appropriate brand. You can only know this with previous experience. In conclusion, condoms are currently one of the most reliable methods of preventing sexually transmitted diseases. It is really effective for viruses such as hepatitis B, hepatitis C, herpes, or penile HPV. You cannot prevent genital HPV from infecting the groin area, but at least in terms of other viral infections, chlamydia, mycoplasma, uroplasma, it is very protective. Again, it has 90 to 98% protection against unwanted pregnancies. As long as the condom is not torn, nothing happens. Condoms are one of the most important commodities that are still valid today. If a person has to have intercourse with a condom, he should definitely know how to use a condom. They should use the most suitable condom. Why am I saying this? So that you don't have a bad memory about condoms. Because even after 30 years, it will catch you and cause you trouble. Thank you for listening. Best regards.